Inflammation is an important part of the body. It's part of the immune response to combat infection. Because what happens when you have an acute inflammatory response, it increases the body's response to bring more blood to that particular area. And what's flowing in the blood are immune cells. So that's the transport mechanism. So you're driving other immune cells from the body. They're transported through the blood to get to the area of inflammation so they can combat the infection, whether it's a bacteria or a virus. So the inflammation is a part of that normal response. But it shouldn't be long-standing. It should turn on and then turn off so that everything goes back. When you get a cold, right, you get a congestion in the nose, you get a cough, well, there's an inflammatory component to that. It's because you've taken in a virus somewhere in the upper respiratory system. The immune system in those areas attacks it. It then calls out immune cells from throughout the body. It creates low-level inflammation to get more blood flowing to the area to try to deal with the acute situation, and then things should mellow out. What they're finding in autism, they're finding in Parkinsons, they're finding in other neurodevelopmental disorders, they're finding it in Alzheimer's, they're finding it in mental health problems, is that the inflammatory cascades don't turn off. There are these particular immune cells in the brain called microglia that when they become activated, it's like a light switch. Okay? They initiate inflammation, they initiate the immune response, they go after an acute infection, and then they should turn off. The problem is there's multiple things that don't turn the light switch off. So the microglia never turn off. And they just constantly are stimulating an inflammatory response. That could be, and when that's happening in the brain, that's obviously a bad thing. If it's happening in the areas where the language centers are, you're going to be affecting language. If it's happening in areas of the brain that are linked to higher cognitive function, you're going to have problems. So yeah, the chronic inflammatory aspects of neuroinflammation are quite significant.